Okay, where did we leave off? We left off, I believe, talking about hemodialysis training, home hemodialysis training. So currently, I just completed home hemodialysis training, and I am now doing hemodialysis at home using the next stage cycler. Uh, I spent quite a few months doing hemodialysis training, just making sure that my fistula was properly matured, making sure that I knew how to operate the functions of the machine, making sure I knew how to set up, making sure I knew how to cannulate myself, making sure I knew how to clean the machine, all of those things. So the past few months was very, very interesting to say the least. I never thought I would actually be able to cannulate. Remember, cannulate? Stick a needle in my arm. Actually, stick a 15 gauge needle into my arm. Actually, two of them. My arterial needle and my venous needle into my fistula access port. So it's yeah, it's been an interesting couple of months. Learning to do all of that. Um, but this is where I'm at now while I wait for a transplant, a kidney transplant, or kidney donor. Apparently, it takes a while for a kidney donor unless you have a living donor who's willing to donate a kidney right away. So that a living donor will be more immediate than a deceased donor. And given my age, my transplant center, which is the NYU Transplant Center, would prefer me to have a living kidney donor. Um, so how did I transition? So, question that people I'd ask because some people who knew that I was on different forms of dialysis previously. So initially started out on hemodialysis. Remember I mentioned earlier with a CVC catheter in September of 2024. And then I transitioned in November to peritoneal dialysis, which was dialysis in my abdomen, where the fluid dialysate would fill my abdomen and dwell. And it'll be a few exchanges of that over a 12-hour period, 10 to 12-hour period um, for peritoneal dialysis. During labs, I mentioned that it was not effective. My nephrologist noticed that I was not getting good clearance, which means my blood was not being properly cleaned, and which I took upon myself to say, Alan, in my head, it's time for you to get a fistula, and I pushed my nephrologist and I got a fistula. I said I need to get a fistula installed. So I got a fistula installed in March, went for the surgery, and it took a while. It took about 6 to 8 weeks for the fistula to mature. And then that's when I started home hemodialysis training in May of this year, when my fistula matured. At that point, I would say, because I was still on peritoneal dialysis while my fistula matured, my health significantly declined because my clearance levels of my blood was barely minimum, barely negligible in terms of cleaning my blood on the peritoneal dialysis. So the when I got onto hemodialysis, when I got to the clinic for the very first day of home hemodialysis training, they noticed right away that I was severely weak. I was dehydrated. I was weak. Um, I crashed, I would say, in the chair. I was, passing out in the chair. The nurses noticed that, so the nurses were shaking me, waking me up, because they noticed how weak I was, and because I was not getting good um, cleaning from the peritoneal dialysis. Para in other words, some people might say it's scary, but I would say I almost had one foot in the grave, because of my blood was very toxic, at that point, and needed to be cleaned, um, properly. So when I started hemodialysis training and I did my first session of hemodialysis, it was a very short session, because my blood pressure was dropping good, and that was another thing. My blood pressure was really, really low in the beginning stages of my hemodialysis training. So it was really, really low, because I didn't have any fluids in me. I was very weak, dehydrated, and coupled with the fact that I had lost over 80 pounds, um, contributed to my low blood pressure and everything. And my blood being toxic, not being cleaned properly, was another factor of me, passing out during my very first hemodialysis training session. It got better, as I went for more sessions of hemodialysis training, as I learned how to do how to operate the next stage machine. My hemodialysis became much, much better. I got a new life in me, as my tech would say. I got my color back, because I was very, very pale. She said, "You looked very pale in the beginning, but now I got my color back, because hemodialysis is much more effective." I met my clearance goals easily, above and beyond, for hemodialysis clearance. They wanted my clearance level to be a 2.0. At this point, my clearance level on hemodialysis was 2.6. So I passed my clearance levels, for the goal of, the hemodialysis actually cleaning my blood. It was actually much, much better. So yeah, that is where I'm at now. I just graduated from hemodialysis training on July 25th. So it took a few months. So now I'm officially home. And this is my hemodialysis room at home. So here I have my hemodialysis supplies. I have spare supplies back here in these cabinets. They're all labeled in these drawers. I have my hemodialysis supplies. Like, for example, this drawer right here is my saline drawer. These are where my saline bags are kept. I have micropore tape. I have gauze, I have band-aids, prep pads, alcohol prep pads. I have needles, syringes, syringes without needles. I have more. I have some boxes back here. I don't know if you can see that. But these boxes are some what we call express bags, which is part of the hemodialysis process, where I currently know how to make my own dialysate from tap water, using the pure flow system on my machine. But in case that's not working, and in case I don't want to use the pure flow and make a bag, using the pure flow, they have what we call express bags, which in my case is my one treatment takes about 50 liters of dialysate, which is about 10 express bags. 10 express bags. So if I want to do treatment for 1 week, I would need 20 of these boxes for 1 week's treatment of dialysis. Because I do dialysis 4 days a week for 3 hours now. So it takes 50 liters for one treatment for me, which is 10 bags, which is 10 bags or 5 of these boxes. There's two bags in each box. So it'll be 5 boxes, 10 bags of express bags. If I'm not using the express bags, I would be using the pack. I would make a pack which is using the pure flow system. So I would make a batch of a 50-liter bag of dialysate using my tap water in my house, which is, there's a pure flow system, there's a whole filtration system that my machine runs through. And I'm going to show you that in a clip in a minute or two. So I'm going to show you my entire machine system, the setup. I'm not doing dialysis today. Before I was cut off by my phone ringing, I was actually in the process. I was doing dialysis, but I said will refilm the second half of this video when I'm not doing dialysis, which would make it easier for me to show you the machine and the components of my machine that I do dialysis on, which is the Next Stage system. Next Stage is a sub company of my dialysis center, which is Fresenius Kidney Center, Fresenius Kidney Care. I'm a home dialysis patient, so my home center is Queens Home Therapy, which is in Fresh Meadows, Queens. So I'm going to go through a couple things. I'm going to show you when as I turn the camera around, my setup at home and how I do dialysis at home. Okay, so stay tuned. Welcome back. I'm currently in my room where I do dialysis. So as I was mentioning before, I have a lot of supplies in this room, as well as my machine where I do dialysis. So here are some bins where I store my cartridges, because they come in lots of boxes and I just want to get some extra space. I stack them in bins. So I have 2 bins of cartridges. As you can see, those are the cartridges. And at the bottom is where I have my sack. I remember I mentioned making a sack for dialysis previously. So the bottom bin is my sack where I'm able to take a sack out and use it in my pure flow system to make dialysate. I have some extra supplies of gloves, mats, blue pads or chucks. As I mentioned, I have saline solutions, micropore tape, stoppers for when I pull my needles. I have 10 millimeter saline syringes, 10 milliliters saline syringes. I have thermometers, tourniquets, band-aids, alcohol prep pads, so blood pressure monitor, bleach wipes. So this, and of course, I have my sharps container. This is my dialysis chair. This is the chair that I do dialysis in. And as part of the home dialysis, they will actually give you a chair if you request it. If you want them to give you a chair. So this is the chair that I do dialysis in. So what actually happens is that during dialysis, this arm comes out, and I actually put my supplies here on this arm, and on the other arm as well. I have more supplies, and I do a setup there of my supplies to get ready for dialysis treatment. So let's go, and of course I have my table where I do my setup. Sometimes I do work here. During dialysis treatment, I tend to do a lot of work. So I do it here. I set my laptop up here. Even though if I'm 3 hours in the day, I would do my treatment here using this table. Again, more wipes. These things really help, making a little pillow for myself, for my hand, when I have my needles, because it's all about the angles some these days. When you put the needle into my fistula access port, sometimes to get the proper blood flow, you need to have a proper angle. Sometimes a little pillow helps, a little elevation. So this is what my wonderful tech made this for me, and I took it home from when I graduated from dialysis training. So this is pretty awesome. Zarita, I love you to death. You are the best in making all of your patients very comfortable, and that's what I enjoy about you during training. And I'm going to see you every time I come to the center for monthly testing with Dr. Khan every month. I also have a stool. This is where I have to sit on when I have to prep my machine, get the pure flow. So this is the machine. This is the next stage machine cycler, home cycler for home hemodialysis. So I have like up here, I have like stuff about my clinic, my medications, you know, in case of emergency, how to contact the nurse, all of that stuff there. I have my cycler. Attached to the cycler is the internet port that actually downloads the information from the cycler to the iPad. The iPad basically monitors my treatment when I'm in treatment, and it actually submits information to the clinic when I finish my treatment. So all the information from treatment gets submitted electronically to my center, where my doctor and my nurses can monitor my dialysis treatments. This is the Pure Flow system at the bottom. The bottom portion is called the Pure Flow. This is where I mentioned before the sac. A sac can make dialysate. So inside the Pure Flow, when I open it up, is a bin, and there are some attachments, some connections that are made in the bin with a sac, and it pulls in water. The water comes in via the cables at the back. There's the blue one. If you see the blue one, comes in at the back, and water comes in, and it comes through a filter and a pack, and gets purified. Chlorine is taken out, so everything becomes pure water. What makes my dialysate in the sac. So I can make a sac right here, a 50-liter sac of dialysate in this bin right below here. I have here more supplies that I use during dialysis treatment. So I have things like needle syringes, heparin. I need heparin as an anticoagulant so I don't clot during treatment. I'm a big clotter. I can clot very easily. So and sometimes that's not good for the machine. So I want to make sure I have heparin doses. So I do 2 heparin doses. I do a heparin dose at the beginning of treatment of 2.5 milliliters, and one halfway during treatment of 2 milliliters of heparin. So I have heparin. I have other cleaning tubes, cleaning syringes, flush syringes, as well as alcohol prep pads, thermometers, blood pressure monitor, little blue chucks, more syringes over here, and more cleaning supplies. So I also have a scale because it's important to weigh. Because I have renal failure, you don't urinate. Some people just don't understand that. Yeah, with kidney failure, you don't really urinate. Especially, it depends on how your progress is. You might get a little sprinkle here, sprinkle there, but you don't really urinate. So how is your blood cleaned? Because the kidneys is responsible for generating urine, and that's how people with fully functioning kidneys are able to get rid of waste out of their body. But because my kidneys are not functioning, I really don't urinate because I don't generate urine. And so how does my blood get cleaned? Which is why dialysis cleans my blood. So dialysis would be the one to get rid of the urine and all of that stuff, all the waste. So there is a waste line that's attached to this machine, that actually, this yellow line, that during when it's fully set up, and I'll show you another video another day when it's fully set up, where the waste line actually takes the waste material from my blood that's generated in my blood, like waste, whatever, what the urine couldn't, what I can't urinate anymore, can't get out, through the waistline out of my body. So that's what's happening when and it's very important that you weigh yourself before and after treatment, so you see if I'm at dry weight or if I'm above dry weight. So right now I'm below dry weight because I'm losing more weight every day. I'm actually below dry weight because I'm on a weight loss journey as well. So I am at right now. And you're gonna actually see. Let's do this right now. Let's actually do this. let's actually see what I weigh in kilograms, because that's what we do. We do kilograms here in my world, in dialysis world. It's all about the kilograms. Let's turn on the scale. Okay. Let's turn on the scale. And let's see how much I weigh in kilograms. Okay. So right now I weigh 86.4 kilograms. What does that translate?